welcome to this explainer. Look, if you're joining me today, it's very likely that you or someone you deeply care about is right in the middle of a fertility journey. And let's be completely honest right up front. Those journeys, they can sometimes feel incredibly overwhelming. You might be hearing big, scary medical terms and diagnoses that you've literally never heard before, which can understandably cause a ton of anxiety. But I want to reassure you right now, you are in the perfect place. Today, we're going to walk through one very specific diagnosis together. We are going to completely replace that confusion with clarity, and we're going to look at the very real, scientifically backed optimism that exists for this condition. We're talking about retrograde ejaculation. So here's our quick roadmap for today so you know exactly what to expect. First, we'll get a solid understanding of the condition itself. Then we'll dive into the causes and signs, look at its real impact on fertility, outline the 3 simple steps to getting a diagnosis, and finally, the best part, we'll explore your treatment options. All right, let's jump straight into section 1, understanding the condition. What exactly is retrograde ejaculation? Now, that medical term might sound a bit intimidating, right? But honestly, it's essentially just a biological detour in the body's natural plumbing. Normally, ejaculation is the process of discharging semen forward through the urethra and out of the penis. But with retrograde ejaculation, the semen just takes a different path. During orgasm, instead of going forward, it goes backward and enters the bladder. Once it's there, it just mixes completely harmlessly with the urine already in the bladder, and eventually it just passes right out of the body as waste. I want to pause here for a second and really emphasize something absolutely crucial. This is simply a known, well-documented physical process. It's just a mechanical misdirection. It is not a personal failure in any way, and it's certainly nothing to be ashamed of. Now, you might be wondering, okay, well, why does this physical detour happen in the first place? And if I suspect this might be happening to me, what exactly should I be looking for? It's completely natural to be curious about what's going on inside your own body. That brings us nicely to section 2, causes and signs. Basically, just learning how to listen to your body. It is so incredibly important to understand that there are clear, easily identifiable medical reasons for this condition. Knowing this should really help lift any unnecessary anxiety or self-blame you might be carrying around. According to the clinical sources, retrograde ejaculation doesn't just happen out of nowhere. It's frequently linked to certain underlying medical conditions. Actually, diabetes is a big one here. It can also be the result of anatomical defects, or it can happen if you've had prior prostate or urethral surgeries. On top of that, taking certain medications or drugs can actually trigger this exact same detour. Fertility specialists see these standard medical factors literally all the time. So, if you have a history with any of these things, your body's just responding to its medical history. That's all. So, what are the actual signs? Well, the most noticeable sign is having slight or even no ejaculate at all during an orgasm. Another super common indicator is cloudy urine immediately following an orgasm. Now, remember our definition from just a minute ago? That cloudy appearance? That's simply the semen mixing safely with the bladder's contents. Like we said, totally harmless. And of course, the third sign, which is usually the one that brings patients into the fertility clinic in the first place, is a loss of fertility. Basically, the inability to conceive a child. Let's transition into section 3, the impact on fertility, or the hurdle we face. I want to approach this next part with deep empathy because I know this is often the absolutely hardest part of the diagnosis to process when you are dreaming of starting or growing your family. The clinical reality is that for males dealing with retrograde ejaculation, natural conception is unfeasible. Because the sperm is taking that detour into the bladder instead of making its way forward to fertilize an egg, getting pregnant through traditional, natural intercourse just isn't possible. And listen, I know that hearing natural conception is off the table can bring up a very genuine sense of grief. It is completely okay to feel that. But fertility treatments are the recommended path to conception here. This isn't a brick wall, it's really just a hurdle. Your path to parenthood hasn't ended at all, it just requires a slightly different vehicle to get you there. With that hope firmly in mind, let's shift our focus from the problem to the solution. How do we confidently diagnose this condition so that we can take action and start moving forward? Which leads us to section 4, the 3 steps to diagnosis, a clear path forward. If you are feeling at all nervous about going to see a doctor for this, I want to ease your mind right now. The diagnostic process is highly structured, it's completely predictable, and it is absolutely nothing to fear. The clinical literature lays out a super straightforward 3-step strategy. Step 1, it's literally just a conversation. Your doctor will ask some questions about your medical history, any medications you're taking, and past surgeries. Remembering those common causes we talked about earlier? Step 2 is a standard, routine physical evaluation of the reproductive parts. And step 3 is the final confirmation, an examination of the urine discharged after an orgasm. Because the semen is entering the bladder, checking that post-orgasm urine sample gives the doctor the definitive proof they need. It really is that simple. A chat, a standard physical, and a urine test. And finally, Section 5, treatment options, growing your family. Okay, this is the most exciting part of this whole explainer. Modern medicine offers some incredibly effective solutions. While, yes, the door to natural conception is closed because the semen is taking that detour into the bladder, a massive, wide-open window exists through fertility treatments. Because here's the magic. Your body is still actively producing healthy sperm. These treatments represent highly viable paths to biological fatherhood using that retreat sperm. The sperm is in there, we just need a little bit of help getting to it.
So how exactly does modern medicine get to it? The procedures are actually remarkably straightforward. In most cases of retrograde ejaculation, doctors can literally recover the healthy sperm right out of that urine sample we talked about. They then wash it, prepare it, and use it in an IVF cycle, specifically for something called ICSI. That's where a single, healthy sperm is carefully injected directly into an egg. But let's say the urine sample isn't the best route for whatever reason. Doctors have incredible backup plans. They can obtain the sperm directly from the testicles. They do this using gentle, minimally invasive techniques like fine needle aspiration or a procedure called TSE, which stands for testicular sperm extraction. So whether they rescue the sperm from the urine or gently retrieve it directly from the source, they absolutely have the tools to help you build your family.
The core message I want you to walk away with from our explainer today is this. Retrograde ejaculation is just a physical detour. That's it. It's a mechanical quirk in your body's plumbing. But with modern fertility treatments, your journey to biological fatherhood is still full of immense hope. The science is there, the treatments are highly successful, and you absolutely do not have to navigate this alone. So I'll leave you with this one thought to chew on. If a biological detour is simply just another route to the exact same beautiful destination, how might taking that proactive first step with your doctor completely change the story of your family?